What really shocked me about gum disease was that it is actually related to Alzheimer's. Dentists using Overjet find about 32% more disease than they would have found on their own.
You might be able to go into a place and get a scan automatically, know your diagnosis on your phone, have a device that you can put on, does the cleaning. Once you merge AI with robotics, there's an opportunity to even scale it much more.
I think after this conversation, I'm actually going to reevaluate my dentist. Welcome to AI Across Borders. It's such a pleasure to have you here today.
Well, thank you for having me.
Now, you've said one dentist told you you had 0 cavities, and then another dentist told you you had 4 cavities. And this terrifying kind of misalignment between the two is what started you on your journey to really think about teeth. Tell me about that.
I changed my dentist because I had changed neighborhoods, so there wasn't, a reason to do it just because, I was going to a place which was closer to me. And just with that change, it was 6 months apart, where one dentist had a more conservative diagnosis, the other one was more aggressive, and that didn't seem right to me in terms of it being a science rather than it being an art, where can you actually determine what really is happening, and that's how it all started for me.
A lot of us don't really think about our teeth much. You have called it a gateway to the body. What do you mean by that?
So your mouth has not only your teeth, it also has your saliva. So the things that you eat, you have your oral microbiome that impacts your whole health. There's also when say, for example, if you have an infection in your mouth, which many people have because of gum disease being a very common or one of the most prevalent chronic conditions in the world, that leads to a lot of other challenges across the body.
Most people don't understand the role that AI can play in this journey of keeping your mouth and its related connection to your body healthy. Tell me what Overjet does and how is it different from what the dentist is doing today?
So currently we're supporting the dentists in their diagnosis. The challenge is that a dentist collects a lot of information. So they're collecting say 18 x-rays on someone, right? Like when they take a full mouth x-ray, then they're taking hundreds of measurements around periocharting, etc. So there's a lot of information that gets collected, and all of it might not get fully comprehensively analyzed as well. Then with newer modalities like 3D, so you're taking a CBCT scan, which is capturing not only your oral cavity, but it also captures your nasal cavity, it captures your airways, etc. So you're capturing a lot of information, and how do you actually fully analyze it comprehensively and ensure and do it more quantitatively as well? So there's been a lot of, for example, I mentioned periodontal disease. One of the ways to diagnose it is by looking at bone loss, and that has been historically a measurement that people have eyeballed. So they've said, hey, you have bone loss or you don't have bone loss. With Overjet, you can actually measure it. So you know exactly, okay, it's 2 millimeters right now. Previously you came, it was 1.5 millimeters. And so this is progressing and you might want to do something about it. So especially when, there are variations across people, right? So it might, that longitudinal analysis or variation, really, you can actually use that as a marker, because maybe, for you, your biological width might be 2 millimeters and you might not want to do something about it, but for somebody else, that might not be the case. So how do you actually look at your data more quantitatively, and how do you look at it more comprehensively? And then how do you use that data to automate and augment different workflows that a dentist ends up doing manually that can be automated as well?
Wardah, I went to the doctor and then they use this metal pick and they check how deep the gap is for the periodontal disease, right? And she checks this and the nurse then manually writes it down on a piece of paper. And she's a great dentist. She's very strict with me. How is that experience different? Is Overjet, are you taking the x-rays? Are you taking real-time pictures? How are you working?
Yeah. So I would say the perio charting that the hygienist did. Now with Overjet, the way it's different is speak it out, and we have our voice to text conversion that happens. So ambient AI, which is listening to it, and then nobody has to manually write it down. So that's where the efficiency starts to come into play. And then in terms of, we also have our X-ray models that read X-rays. We also have, models which read perio charts. So we have models that go across the different clinical modalities and read the different types of data as well, so that we can actually look at it more comprehensively.
What really shocked me about gum disease was that it is actually related to Alzheimer's. Can you explain what is that connection? Is that true?
There are many studies done on this, and so far they all point towards that. Of course, you can never know for 100% sure, but the way they look at it is the inflammation. So I think there was a study by University of Toronto, which was very, very useful in terms of where they showed causation, where they showed that because of that, the gum disease is an infection, I would say, and that what it leads to is, say if you had an infection anywhere else in your body, right? Like how would your immune system react to it? It's the same thing. The closest link that they've shown is towards inflammation, and they've now shown it in mice, etc., where one is causing the other. So as your immune system is going in hyperdrive, it's impacting it worse.
I did not realize that if my gums bleed, and they used to when I was younger, because I was not very particular, I think like a lot of young people, about flossing all the time, that actually it is quietly increasing the risk for dementia and many other diseases as well. Did you study medicine? Wardah, what is your background? How are you into this AI for teeth and the mouth industry?
My background is more from the technology side. So I did my PhD at MIT working on autonomous systems. So my undergrad, I did robotics. Then I did in my master's and PhD was focused on clean energy. And then I made a shift towards healthcare in my postdoc. So consciously, I wanted to work on technologies that could impact human lives and not have politics be the reason why it doesn't go into production. So it became, looking at it, it was like, okay, healthcare is where I wanted to be. And so I made the shift. And then in healthcare, dentistry seemed like a great fit for me because of the fact that you can make change much faster because the incentives are more aligned, I would say, because the decision makers are also the clinicians who are diagnosing, who are treating, etc. So they can see the value and make the decision. While in a hospital system, the clinicians might not always have the say in what actually gets utilized. So that was one of the reasons what attracted me to dentistry. The second was that it impacts almost every person in their life. So it's not some niche thing that, we could, if we make even a small change, we can have a very large impact.
It's traditionally not considered a very sexy application of AI. But in fact, given that it's so important, it's actually very, very relevant to all of us. You have raised the most money that anybody has raised for dental AI. And what was that process like, going and trying to convince venture capitalists that this is actually a really important and viable area for AI applications?
I think, healthcare in general wouldn't be the first place that you would have newer technologies going into market because of just the adoption. And you had a generation before us who where when they went into market, the AI wasn't there, where it wasn't surpassing the physicians or in our case it wasn't before us, the technology just wasn't there. So we were created at the best opportune time where deep learning had evolved to a point where when we got our products out, we were surpassing dentist level accuracies and be able to prove, get FDA clearances more easily because of that and get to market more quickly. So I think that was another factor. At that time when we started early on, people, it was could AI even do this? I think that was the question. Could AI be able to ever number teeth? And numbering teeth is the easiest problem there. For us now, and it's the models are 99 point something percent accurate at doing it. But that was the question. And because, you had each tooth was slightly tilted, so you couldn't just use bounding boxes had to move around the teeth, and even that stuff hadn't, it was very early days, and transformer models had just the paper had just come out. So I would say I think it was early-ish and it was just taking off.
As a customer, when I go to the dentist and I heard you use the way FDA approved, what does that mean, and why is it important for patients that your dentist is using something that's FDA approved?
So it's FDA cleared, so class 2 devices get FDA cleared. Class 3 would be FDA approved. The benchmark they have, there are 2 things that you have to prove. One is that the AI is at par or better than dentists in standalone. Then second, more importantly, you have to prove that the dentists are better diagnosing with it. So they diagnose without it and then they diagnose with it. So you have to prove, that's another burden of proof that you have to show. And once you can do that, so not only you know that the AI standalone is good, you also know that the dentist plus AI is better, and that helps you clear the bar. If you're not FDA cleared and you're in market, you might be in investigational purposes. It might be still developing, or you might be testing it out. So knowing that helps, because of course you want to it might have not crossed the bar, etc. That an FDA cleared technology has.
And what does that process look like? Do you conduct surveys, and how many people do you take into account when you're working with dentists to get FDA cleared?
We need to have clinical studies that we do, but they're not that invasive as class 3 device, or the risk is lower here. Statistically, you have to determine that you've proven it, and for example, if it's something very simple like tooth numbering, that is very easy to do, and you have teeth in every image. But say if you have a disease which is present in 1 out of 100 patients, right? That's finding needles in a haystack. The numbers might change based on that.
In your experience, I read that dentists using Overjet find about 32% more disease than they would have found on their own. And that number is wild. It basically implies that there are millions of people like me potentially running around with undiagnosed problems right in my mouth.
Yeah, so that's probably from a clinical study that we did. So we would have done it without Overjet, then we would have done it with Overjet. And I think it's just human nature. And you think about it, if you're looking at multiple X-rays and you have will you find everything? Sometimes you're noticing something, there's some big issue here, and you might not notice an issue somewhere else. So that's also that happens to us as well. There's also your screen, how your screen is. There's many other reasons why you might be able to you also get tired. That's also a real thing. If you run a very long study, if you make people sit for 5 hours straight or something like that, you might start seeing fatigue. They might be diagnosing less effectively than they were doing in the start of the day. So you need to look at all of those factors, and you have to create studies so that those things don't come into play. So they run over a longer period of time, just in general. For every disease, it might be different as well. Some things they're very obvious. Some things are more difficult depending on how large it is. If it's very large, I think that probably everybody will get it. But if it's small, they might miss it. But it isn't the end of the world in a way. If they miss it, dental disease is slow moving. So it will if you go to the dentist regularly. However, for people who don't go to the dentist regularly, then that's a problem, because then it would have evolved. For example, if you miss it, earlier, and now it has if you catch it early, you can actually reverse it or stop it, right? So you can arrest it. But then once it crosses into the dentin after your enamel, you only can have an invasive treatment. So you'll have to do a filling, for example. And then once it crosses more and now you're touching your pulp or some, then you'll have to do a root canal. So it gets the more you wait, it gets worse. And similarly for bone loss, when we mentioned gum disease before, it doesn't go back, right? So it's only getting worse. So the faster you act, the better. But I would say the good thing is the dental disease, unless you don't have dry mouth or other conditions, which many people do actually. So like, if you don't have those, then it should be, if dentist missed it, the next time you go, they should be able to catch it, hopefully. But like we do see a lot of misdiagnosis as well.
You see misdiagnosis by dentists, but do you also overdiagnose with AI? And, a lot of my friends are now doing full body Pronovo scans. I actually went to my doctor and I said, should I get an MRI instead of a mammogram? And there's a lot of conflicting advice that I get. They're like, oh, it will notice everything that won't even develop into cancer, and that'll cause anxiety. And I do get anxious about health. So now it's different. Before a dentist would say, there's something wrong with your teeth. I'm like, whatever. But now it's at the back of my mind. We all know it's related to 10 other things, from cardiovascular to Alzheimer's. What is the fear of overdiagnosis when you have AI looking at every minutia in your mouth?
Yeah. No, that's a very solid point. I would say that's, early on I mentioned around longitudinal, right? So like, the first time you do it, you might notice something and you'll be like, okay, should I treat it or not, right? But that's where if you've like taken like say two data points, you can actually see, hey, how much did it progress? Like I might have a lesion for like 4 years and there's something there, but it's arrested, right? Like it's not like growing more. Should I treat it or should I let it be? So like I think the longitudinal, and I'm not a dentist, I'll let the dentist handle it, but like just in general, like, I think that's a view that as a patient I really like, because you can actually now look at 2 data points and see and make the decision yourself, saying, okay, nothing, it's where it was, so like things are okay, and I can probably come in again and check it out.
What's the difference between Overjet and ChatGPT and uploading your dental records to ChatGPT?
So you can try uploading your X-rays to ChatGPT. I don't think it can analyze it. They have not learned from that data yet. We've really fed our models with very high quality data, and getting to the accuracies that we get to is very hard for these models.
So you've kind of really fed it. You made it an expert in dentistry, dentist theory, knowledge, data, which a generic LLM may not be able to do.
Yeah.
Now, let's go on to the fact that a lot of parents have kids. Kids, both you and I are moms, and kids are always eating candy these days. And even if they're not, if they have a pain, you kind of find out at the last minute. It was really intriguing to me that you actually have a dental AI that helps dentists take care of kids. Tell me about that.
So one thing is that dental anatomy for kids is different than for adults, right? You have the primary teeth, which have not fallen off yet. So their X-rays look very different. So I think it's just like understanding that kind of anatomy was the first thing. Then you don't have, for example, like periodontal disease is not a thing in pediatric dentistry, but also the way the enamel is a little different. So the cavities also appear differently for it. And the idea here is that, like, how do you show it more visually so that dentists can actually then educate the patients as well as their parents. So the kids are like learning about their health, but also like the parents are seeing, so that they can do the right thing for the patient as well.
So it's highly, highly specialized and all thing dentistry related. And I think this is the new era that we're entering into, which is highly specialized assistants for different roles and industries. Now, let's go to the dentist himself or herself. Let's say I'm a 50-year-old dentist listening to this, and I want to learn or add Overjet to my clinic. Is it like an iPhone where I can just swipe through? Is there some training that I need to go through? How does it work?
So we have multiple products. So when you say Overjet, they could be getting our imaging piece of a product, or they might be getting our imaging software, or they might be getting our insurance verification software, or they would be getting our voice software. So there are like multiple solutions that we have. I would say our core product would probably be the imaging that people have what we started off with and they know us for, which It's pretty straightforward. We have a video training that people watch, but it is a button. You just have to click a button. You have to click view image, and then everything appears. So there's not more than that. Of course, for power users, there's a lot more. So we kind of build it for your basic use case. All you want is the findings, and all you have to do is click an image. But like when you then start looking at, hey, what does this mean? And like we have this ratio called DMF ratio that really helps you on the claim side. We have like other pieces which are, I would say, more for the power users who are using it more broadly. People have like built it out for their different workflows around extractions and other things that they're trying to do, or referrals. So it becomes a much more powerful platform when the people start utilizing it. But I would say simply you just have to click a button.
And what about children or students who are going to dental school? Are you offering this? Because I spoke to somebody and they said their school doesn't even mention AI or teach them anything about AI in healthcare.
We are in about like 25% of the dental schools now, in different forms, like where some are just research agreements, others are more, they're using our product for educating and training. So it is getting not across the board yet, but it is starting to get adopted in schools to teach, because they will have to use it as they grow, because a lot of practices are adopting it as well. And I think in schools, we don't, it's not just like teaching them the software. It's more about them understanding, what AI can do and what it can do, so that they become better clinicians, and so that they still trust their instincts, like having this as a tool that helps them. And how do we train the dentist to be able to do it? Because you have, of course, when it gets very easy and AI gets better and better, you start really relying on it, but then where do you need to come in and where do you not? Because in the end, the dentist is making the diagnosis. So those are the things that we like to teach with the faculty members, so that they're learning it the right way as well, and like still learning their diagnosis skills. We've done some studies. I think it was University of Florida, where they've shown that students learn much better with this technology.
Would you go to a dentist that does not have an AI assistant?
I don't want to go to a dentist who doesn't have AI.
Would you demand that they use it and show you the second opinion of the AI?
I would change my dentist if they were not using it.
This comes up a lot, where especially in breast cancer, a number of women said that they choose hospitals where the radiology department is using AI. And one woman said it actually helped her with early diagnosis. And I think we're going to see that in every vertical, but it starts with patients demanding it and doing that research, which, by the way, I've never done. But I think after this conversation, I'm actually going to reevaluate my dentist and ask her if she's using it. Now, one of the things about dentists, it's expensive. It's kind of a luxury, let's be honest. What about democratizing access to dentistry for people in the developing world?
I would say in general, dentistry isn't that expensive. However, of course, not everybody can afford the treatments as well. And how do we decrease the costs? And I think that's been one of our key focus at Overjet, where we believe a lot of the cost is due to the administrative cost of running a practice that comes into play, and how the chairs and everything gets utilized. So how do you actually reduce that cost, so that when the dentist is there, they're spending time with you rather than doing paperwork. They're doing it faster, so they can not have to spend that much time, which is like better utilization of the chairs and reducing the cost further. And then you don't need a person trying to put data into the system as well. So you don't have to hire additional folks because you're able to just, while doing the procedure, you're able to say something and it can be recorded, etc. as well. So I think that those are a few areas that we are focused on, and how do we ensure that There's a lot of costs, but then it comes down to claims as well. So there's a full-time person, about 70% of their job is like calling insurance companies, checking for this. How do we automate that? That we created a product around that as well. So those are some of the things that we can actually do in a clinical setting. Now, beyond that as well, there are a lot of places in the world, and I think in Pakistan as well, where there are very, very few oral radiologists, for example. And I have not met anyone in Pakistan who is an oral radiologist. In the US, you have a few hundred oral radiologists. So it is, increasing that access to oral radiologists also helps in reducing these costs as well. Those are some of the areas that we think can impact, or we can impact in the short term. And of course, if we look at the long term, as robotics comes into play as well, we build more technology that can be standalone. You might be able to diagnose, go into a place and get a scan automatically, know your diagnosis on your phone, walk out, have a device that you can put on, does the cleaning, you can go, so once you merge AI with robotics, I think there's an opportunity to even scale it much more.
I want to double click on that in my last segment, but I want to first complain about the fact that I have to justify to insurance companies all the time why I'm going to a doctor, what process is happening, was it really necessary? Does Overjet help consumers like me justify why we needed that cleaning, that periodontal check, etc.?
So we help in two ways. One is the data. We actually review the data and make sure that it meets the criteria as well. So you're not thinking one way and you're getting a different answer later. Secondly, we work with insurance companies as well to make the decisions much more objectively and faster. So can we speed up that review that might have taken, say, 14 days or so? Can we get it down to a few hours, but then get the payouts in 7 days? And we have had those results already, which help, so you're getting faster payouts, you're requiring the limited information, but being able to then do it much more objectively as well, rather than going back and forth on this with the providers, and ensuring that, if both the providers and payers are looking at the data the same way, so that you're not getting different answers as well.
This is huge, by the way. My in-laws are often on the phone with insurance companies. It's a huge waste of time. So it's one thing that I think everybody will be very grateful for. I want to delve into the future of dentistry. You're not a dentist, but you're a roboticist. You're at the cutting edge. You mentioned a few things, which is devices we can put in our mouth, automatically kind of having scans. Talk to me about what you see as the future of how we'll look after our oral health.
AI is going to take a bigger role across all parts of dentistry, all the way from the diagnosis to the treatments, to the treatment plans, to the devices, etc. that get utilized. Think about the lab material, etc. as well. So I think there's an opportunity to work across many different areas, as well as have an impact on it. And then you have your administrative work that I mentioned before, where there's a lot of money that's wasted across healthcare, but in dentistry as well, dealing with paperwork, dealing with back and forth, the forms that get filled on paper, then get put into computers, etc. How do we digitize that much more effectively? How do we provide the right solutions there? How do we use voice as a very important way of capturing the information and then getting and inputting the information as well, so that people don't have to fill all these forms too. So I think that's one where just things will get much more efficient, and dentists will get much more effective in what they do, and how many patients that they can see and what value that they can provide as well. Then I think Of course, you have innovations happening in right now in robotics as well, where very early days in dentistry, but we have at least one kind of robot in the market where it helps you in the treatments, but then you have other robotics startups that are building for automated cleanings, for example, being able to then do the procedures automatically as well, that I'm very excited about. I think that that'll help in getting really good treatment across the board, so you don't have to go to the best dentist to get the best treatment, and you would be able to get a very high standard of care with any dentist, or hopefully even beyond that as well. And then in general, I think, how do we get that information to the patient in such a way that they understand it? Because in the end, the patient is becoming more and more informed about their health, and they want to be involved in the decisions that are being made. And people want to know, and once they know, they want to be healthy, right? Like, patients do want to be healthy, but they want to understand it as well. And how do we actually get that data to patients? How do we make them understand about all these different conditions? They don't need to be a dentist to be able to understand everything. What does that look like? And I think there's a lot of interesting, exciting work to be done there as well. One thing that I'm very excited about is something that we've built around the oral score. So how do you know we're trying to solve a problem around, we say we help improve oral health. How do you measure that? How would you look at it? So we actually developed, and it got published in Nature Scientific, a way to measure oral health, and what we call the oral score, where it's a cost function that we've developed based on the probability of treatments happening and the cost that will incur to restore to health. And that is something that we can use as a measure to say, okay, how are we improving and at what cost, right? So are we improving it significantly at lower cost? And that's kind of the future. And so you can start to improve this metric over time. That's something that we help build, etc. But we hopefully will roll it out across our customer base to be able to capture it, and then start so that patients can understand their oral health, they can understand their oral score, and know where they stand and what do they need to do to improve it.
And do you think there'll be one day a device I can just put in my mouth, go to sleep, and it automatically updates Overjet? And if so, and it's also the devices with the automated cleaning in my mouth, do we even need dentists in the future?
I would say, doctors do more than just the procedures that are done. Like, even right now, do you want to, even for me, will I just have Overjet output and just get a drill in my mouth, from a robot? Probably not. I would want, I know some really good dentists, and I would want their opinion on it. What AI is doing right now is improving the floor. There's better standard of care across the board, and with these technologies, we're improving that. But then I think there's opportunity to extend it further as well, and then spend time on things that you might not spend time on because you're focusing on the basic stuff right now, right? And I would say dentists can focus on the next thing and the next thing as well. So do we need that much human input going into cleanings? I don't know, right? Your basic cleaning could be done, but dentists then or hygienists could focus on the periodontal disease and really trying to get that in check.
I think that's a really exciting thing, Wardah, is that people think that sometimes people say, well, you know what, we'll just care for the patient. I think caring is important. That's very important and a human thing. But there's so much more to be done too. Interesting research to do with AI, exploring new problems and correlations. And that is exciting for anyone who thinks about any aspects of healthcare. I have to say, I've never talked about teeth or dentists for so long with anyone before, but this was a great conversation. It not only made me think about the healthcare, but also about choosing the dentist and the criteria. And also, more importantly, as a mom, as an aunt, about what some of my nieces and nephews who want to go into this field, what they can do next. Thank you so much, Wardah, for your time today, and look forward to seeing you in Singapore very soon.
Thank you, Asha.